I think your average person in the street thinks we all share information appropriately and wonderfully in healthcare, electronically, seamlessly, routinely. We don't. We have many more problems from an inability to share information than we do from inappropriate sharing of information.
There is a fair group of people who think that doctors will become extinct. I'm not in that group. I think that the role of doctors will change.
You can't ever replace this conversation that you'll have with a person with technology. That human connection in the space of well-being and with young people is incredibly important.
A doctor can be subject to fatigue, tiredness, and he or she can make mistakes. The main objective that we really want to achieve is to help doctors be more consistent between each other and to improve their accuracy.
We've had a whole debate around My Health Record, and we had 2 million people who opted out. Why are they expressing concerns? Because they weren't consulted, and a lot of people are suspicious about the harvesting of their data.
We are basically these days in a sort of a war, an unofficial war when it comes to electronic information. There's a whole bunch of bad people trying to access it, and there's a whole bunch of good people paid to and constantly exploring ways to keep them from it.
Probably one of the challenges is there's not a universal description and understanding of what digital health means. We don't have a framework necessarily that's come from United Nations or the World Health Organization that clearly defines all the parameters of this space.
If people can't agree on the terms, and it's used in different contexts in different ways, then how are you going to develop effective policies, and how are you going to agree on what's the best way forward to protect public's interests?
I took quite a while to come to a very simple one-line definition of it. I've defined it here as the use of digital tools and interventions in wellness and healthcare.
The way we're solving seizure prediction takes advantage of all different ways of doing digital health. So not just basically developing machine learning or AI algorithms, but taking advantage of cloud computing to make data available for other researchers around the world. We don't really know what algorithm's best, and so by linking everything together, all these digital tools, we're able to work towards solving a really hard problem in epilepsy, which is seizure prediction.
What I'm doing with my team, namely developing computer programs, can be integrated with the digital images to help doctors to detect diseases more accurately.
But in Melbourne, we ran a clinical trial of a seizure prediction device that had the device implanted for up to 3 years in duration. And so with that device, we're able to get long-term data and therefore be able to get enough seizures from each patient to be able to develop reliable algorithms. The predictions we generate could be used to activate a brain implant that could electrically stimulate the brain or deliver drugs to stop seizures from happening. We're also working with Melbourne Uni and Cheah Medical and supported by Epilepsy Foundation of America and the Mayo Clinic.
Studies frequently show that they cannot agree amongst each other, for example, whether there's lung cancer or not, which is actually very scary from the patient's perspective.
We are planning to develop an app which will identify from a photograph taken from a handheld device the nutritional content of a plate of food.
Monash, Malaysia, we have some new courses introduced for artificial intelligence. Right now, in the unit that I'm teaching computer vision, there's more emphasis and more material being introduced in deep learning due to deep learning becoming such a popular subject.
The use will be extensive, not just for diabetes or hypertension or obesity, but for normal people like you and I, because it's such a common thing for people to take photographs of their food.
We gave them a little device, what we call a telemonitoring device, where what they would do is they would measure their sugar levels. And what we could do is we could actually analyze it and give basic advice on diet basic advice on medications, whether we need to adjust medications to patients. We could actually send them advice that said, look, your sugar levels are just too low, you need to do something. So perhaps you could see a doctor, you should be adjusting your medications. We became sort of a middle person between the doctor and the patient. We could be a game changer.
So Ash is a robot, but it's powered by artificial intelligence and machine learning. Ash just basically gives educational information about mental health and well-being. So a conversation might be a young person says, I'm really struggling today, I feel like I'm losing friends, and then Ash will respond with supportive comments. Like, tell me more, what's happening, and if they're at risk of hurting themselves, there's an alert trigger in Ash. So a caring person or a teacher or the wellbeing support team are alerted, and they can step in and help that young person.
I see the internet as a dangerous space. It's one where there's a lot of optimism, but it's also one where there's a lot of dangers and where people can be misled, deceived, manipulated in various ways.
Careful embedding of the technology in the human-to-human contact so that we are not actually causing harm is really an important aspect of the whole situation. These are very vulnerable populations that we are working with. And great damage could be done if we don't deal with them in a sensitive fashion. If we imagine in a very heavy-handed fashion, we come in and say, okay, we're going to do away with all of this, and now on, AI programs are going to teach homeless youth about risks of HIV. From now on, people who are going to remind TB patients to take their medicine and all of that, that's all going to be this AI program that's going to do all of that. You can imagine that this can actually cause tremendous harm to the communities.
You don't know what it's like waking up every morning and the first thing you look at is Instagram and supermodels doing all sorts of things, and then you turn to Tumblr to get some help to cope, and it's telling you to self-harm. So something like a chatbot in a school setting that could give them that information automatically, but they don't need to turn to the internet to get that support, will hopefully be quite effective.
We have to always remember that at the end of the day, successful healthcare especially is about helping people. And there's no question about the value of the personal relationship in that. Still hear a lot of people talking and writing like the machines are completely autonomous and we're almost pre-Terminator and they're just going to march in and say, you do not have a job anymore.
What has happened is that now it seems like computers with good algorithms can actually interpret these things better than a human being can. And over time, they get better and better because they learn, they keep learning. And as they learn, that learning remains within the system. And then over a period of time, it becomes extremely powerful.
We are not trying to eliminate the human in the loop. When we are talking about HIV prevention and educating youth about HIV risks and so forth, it is a social worker who's talking to the youth. On the other hand, where the AI technology is useful is in identifying which peer leaders to select in the first place. So there's places where the technology is actually beneficial, and we should identify those places.
A lot of it's basic public health. We've got a large portion of the population today at the global level and even in Australia who live in poverty or don't have access to clean water or good shelter. Yet we keep pouring money into the technological fix, whereas low-tech or no-tech solutions are the ones that we urgently need.
The machine makes a mistake, then who's going to be blamed? Will the engineer who developed the machine be blamed? Or will the company who developed the machine be blamed? Or will the doctor who is in charge be blamed for that?
In those individuals that we actually spoke to, so a lot were really optimistic about digital health. They really see it as the future of healthcare. However, some did raise some concerns in terms of data privacy. Just the wearables that we are using, a lot of data gets uploaded online, but really, they were wondering what really happens to this data.
What do we do with that data, and does it end up getting held by the school? And what we're thinking is the wellbeing team will get access to that, and will be following the same sort of confidentiality as they would if they were having a session with a school counsellor. It's a big challenge.
The biggest companies in the world, they're in the business of monetising personal data. I think people have got a lot to be concerned about if they're handing over their information, their health information, which is very private information.
Health data is much at a higher risk. If the risk of my illness is known, I have 50% chance of getting a heart attack in next 5 years. If that data were to go to corporate companies, let's say insurance companies, they can use that against you. they can use that to say, we're not going to insure you.
If you have all of Australia putting in their data and sharing it, and you derive conclusions from all of that data, then you can make conclusions that are actually useful. That's the benefit of doing it. So for me, the benefits outweigh the security risks.
This is coming so quick and so fast. I think nobody has got around to understanding it and how to manage it, how to regulate it.
I think there's a bit of an AI gold rush on at the minute, and I think a lot of people are spending a lot of time and effort in that space, running off in lots of directions because they think there's a lot of money to be made.
That AI will be incredibly important in the future as we move forward in digital health space. I don't think we should be afraid of AI and what it can produce.
When have we succeeded in digital health is when we stop using the word digital. When at the healthcare we provide and the wellness care we provide is just inherently using IT and tools like it to the right safe extent.